الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Scrap Typhus Orientia Tsutsugamushi by Professor Mahmoud Hani Sulaiman. These are rickettsial diseases, their causative agents, and their vectors and reservoirs. Typhus group: epidemic typhus, endemic typhus, epidemic typhus. Vector is louse, reservoir humans. Endemic typhus, vector rat-free, reservoir rodents. Scrap typhus, vector mite, reservoir rodents. A spotted fever group. Indian tick typhus, vector is tick, rodents and dogs are the reservoir. Rocky Mountain spotted fever, vector is tick, reservoir rodents and dogs. Rickettsial pox, vector is mite, reservoir is mice. Other rickettsial diseases: trench fever, vector is louse, reservoir is humans. Q fever, vector nil, reservoir cattle, sheep and goats. Definition: Scrap typhus is a serious rickettsial illness characterized by an issue at bite site, possible skin rash, and an initial flu-like febrile illness with complications as respiratory and renal failure, meningoencephalitis, and severe multi-organ failure. Microbiology: Scrap typhus is caused by Orientia species, most commonly Orientia tsutsugamushi, an obligate intracellular pathogen transmitted to humans by trombiculid mites. Trans-ovarian transmission: the disease organism is transmitted to eggs through ovary of infected female, e.g. Orientia tsutsugamushi. The agent for scrap typhus transmitted by trombiculid mite, Leptotrombidium dehiscens. Epidemiology: Orientia species predominantly spread across Asia-Pacific region, but emerging evidence suggests a worldwide distribution in tropical and subtropical zones. Scrap typhus is leading cause of treatable undifferentiated febrile illness in many parts of Southeast Asia. World distribution of scrap typhus cases and Orientia species. Coming map. Originally, scrap typhus believed to be restricted to Tsutsugamushi Triangle, most occurring in Asia-Pacific region, shaded in purple in the map. However, serologic evidence from Kenya, Congo, Cameroon, recent reports of Orientia species in febrile patients from Arabian Peninsula and Chile by PCR culture and sequencing, and reports in rodents from southern France, South Africa, and Senegal by PCR are suggestive of a more worldwide distribution along the tropical and subtropical belt. This is the map shows distribution of scrap typhus in the world. The red circle, humans with antibodies against Orientia species. Here. Rodent, the green rectangle, rodents with Orientia species gene fragment sequences. Here in Europe and here in South Africa. The star in red, humans with antibodies against Orientia species antigen and tissue sequences of Orientia species in Arabian Peninsula and in South America. In purple, endemic areas, this is the Tsutsugamushi Triangle in Southeast Asia. Here, this picture on the left is A, this on the right is B. Scrub typhus issues typically occur along areas of restrictive clothing, e.g., belt, collars, sarnugs, or elastic bands or of bra, or in axially growing areas or under breast. It needs careful examination. This is the mites are very small, larvae about 0.3 millimeter, adults about also 3 millimeter, and have autofluorescent properties under ultraviolet light, as here in D. Diagnosis: historically gold standard diagnosis of scrub typhus based on serology, but added value of PCR in early bacterial dissemination phase of disease lead to combination of PCR plus serology for most rickettsial disease, PCR plus serology. Therapy: scrub typhus is easily treated with appropriate antibiotics, doxycycline, azithromycin, and chloramphenicol. Upon clinical suspicion, early consideration of empirical treatment is just. Prevention: many heterogeneous strains of Tsutsugamushi and lack of long-term protective natural immunity pose difficulties in vaccine development. Currently, no licensed vaccine or vector control efforts are available for scrub typhus. Prevention is limited to rigorous use of insect repellents as N,N-diethyl metatolamide DEET, which provides effective but short-lasting protection against ticks and mites during travel in rural areas of endemic countries. Prevention continued if previous measures not available. Delousing infested person with application of 10% DDT as dusting powder to be repeated weekly for 3 to 4 weeks. Steam disinfestations of all the clothes. High standard of personal hygiene to be maintained by daily bath. وأن أقول الحمد لله رب العالمين و thank you for your good listening.